born in a hospital in the United States today, within hours of coming from source into this, into this body, the first thing that happens to them is pharmaceutical intervention without really asking, there's barely informed consent about this. That child's eyes are smeared with erythromycin ointment and they're given a hepatitis B vaccine in their first day of life. And the Hep B vaccine is for hepatitis B, which is a sexually transmitted disease and IV drug user disease, of course, which babies are not going to be exposed to. And yet every single baby in America is getting the intervention. So from literally the day we are born,
Peds Patrol here, and let's talk about hepatitis B in babies and how clips like these can cause a lot of mass confusion. So in the US, hepatitis B is actually quite common. This is data from 2006 to 2021 looking at adults who have hepatitis B in the United States. And as you can see, it is quite prevalent. However, that little baby blue line here is for hepatitis B cases in children. And you can see that it's negative. So you must be asking, why is it that children don't have hepatitis B? And that's because of the vaccination program in the US that vaccinates all children against hepatitis B in their infancy. It's actually important to vaccinate infants and children against hepatitis B early on because getting hepatitis B when you're a child can lead to chronic hepatitis status and can lead to serious medical consequences as children get older. And keep in mind, you can get hepatitis B from things like IV drug use or sexual activity, but you can also get it by sharing fluids, like for example, during the birthing process, a lot of secretions by kissing and touching, and even blood. So on the contrary, children and infants can get hepatitis B, especially if there's a high risk in the family and in the community. Now, in Canada and Ontario specifically, our prevalence is quite low, so it doesn't really naturally occur in the population unless you're a recent immigrant or you do contract hepatitis B later on in your life. So we actually offer hepatitis B in young children when they're around in grade 7. And even with this protection, most children do not get hepatitis B and our prevalence is still quite low. If you are a mom that does have hepatitis B and are pregnant, or you live in a household that has somebody with hepatitis B, then we do actually offer the vaccine at time of birth and then subsequently at 1 and 6 months of life. Hepatitis B in infants and children is actually a very big deal. So if you are following any advice, please speak to a qualified practicing medical practitioner who has up-to-date information about whether or not you should be getting vaccines against hepatitis B or not. And if you are worried or if you don't have any clarification, ask for a referral to either a travel medicine specialist, a family doctor that specializes in hepatitis, an infectious disease specialist, or even a gastroenterologist. All of these specialists can really help figure out what's the best plan for you and your child. Not only for right now when the baby is born, but in the future as well. The more information that you have, the more knowledge you have, and the more empowered you have to make informed decisions with consent.